name's Ariel. I'll be your nurse for the day, and I'm here to do a assessment on you.
Okay.
I've gathered and prepared my materials to go ahead and do this assessment, and I've sanitized my stethoscope. So before we get started, will you tell me your name and date of birth?
Amber, July 6, 2000.
Perfect. And so like I said, I'm here to do an assessment on you. It's a physical head-to-toe assessment, and it's going to be about 20 to 25 minutes long. Do you have any questions before we get started on that?
No.
Okay. I've reviewed your history in your chart, but before we go any further, do you have any cultural or spiritual beliefs that could impact this assessment?
No.
All right. I'm going to go ahead and close this curtain for you and close the door just to provide some privacy. And I'm going to perform some hand hygiene before I get started with touching you. So the first part of the assessment that we do is called the general survey. So I'm looking and I'm first going to assess your level of consciousness. You've already told me your name. Can you tell me where you are?
The hospital.
And what are you here for?
A checkup.
And what time of day is it?
The afternoon.
Perfect. So with those 4 questions, I'm able to say that you are alert and oriented ×4. So that's good. That's what we want. I'm now going to assess your airway, breathing, and circulation. And being that you could talk to me and tell me who you were, it doesn't look like you have any difficulty breathing. You have no cyanosis or pallor. I would say your airway, breathing, and circulation is good.
Okay.
I'm looking at you and you have good posture. Your shoulders aren't shrugged forward. You have good personal hygiene. I can see that you are appropriately dressed for the weather outside. I don't smell any body odor, and you are well groomed. You have good speech and articulation when you were telling me who you are and why you're here. And your just overall state of health, you look your stated age, and you look like you have a good nutritional state right now. You don't look malnourished, so that's good. On a pain scale, 0 being no pain, 10 being the worst pain you've ever been in, can you rate your pain right now?
0.
Okay, perfect, so 0. Now we're gonna move on to the head, face, and neck part of the assessment. I'm gonna go ahead and inspect, palpate, and listen to your arteries. So do you have any questions before we do that?
No.
Okay. So we're gonna do your head and face first. So I'm looking at your skin color. It is uniform and intact. You have a nice clear face, no acne. Looking at your scalp, there's no deviations or masses that I can see. No visual signs of edema on your face. It is symmetric. Let's see. Your hair is evenly distributed. You have a good amount. It's a good texture. It's a normal color. And I don't see any signs of infestation. But I'll go ahead and put gloves on later and we'll look at that as well.
Okay.
Your head is normocephalic, which means it's a normal size for your body. All right, I'm going to assess cranial nerve number 7 by having you do some facial expressions.
Okay.
So will you frown for me and smile, puff out your cheeks, go ahead and let that go, and then close your eyes tightly and open. All right, so cranial nerve number 7 looks like it's intact by you being able to do all those facial expressions.
Okay.
I'm gonna go ahead and put on some gloves. That way I can get to palpating your head. So I'm going to just lift your hair and look for signs of infestation. No signs of infestation, sorry. The scalp looks clean. There's no redness or flaking. I'm going to palpate for any edema. Do you have any pain when I do that?
No.
All right, no edema. It is symmetric. No pain or tenderness in the head. I'm going to palpate your sinuses. So your frontal sinus, any pain there?
No.
And your maxillary?
No.
And then let's just palpate the rest of the face. Any pain or tenderness?
No.
No edema. I'm going to palpate what's called your TMJ. So go ahead and open your mouth for me and close. So I was assessing to see if there was any clicking, and there wasn't. It was nice and smooth when you opened. And that is a normal finding. Let's see. All right, so now we're gonna move on to your ears. Is it okay if I move your hair to get a good look? Let me throw up those gloves. The ears are symmetric. They are uniform in color. No lesions. It looks like you have your ears pierced. No redness or drainage. I'm gonna touch your ears. Let me know if you have any pain, okay?
Okay.
So when I pull up on the pinna?
No.
And on your lobe?
No.
And when I touch behind your ears?
No.
All right. Now we're gonna move to your nose. Again, I'm looking for any drainage, any deviation. I'm looking for symmetry. There's no redness or swelling. Good position. All right, I'm gonna touch your nose. Let me know if you have any pain or tenderness.
No.
All right, so will you go ahead and cover one nostril with your finger and breathe in and out? And do the same thing on the other side. Okay, so what I'm testing is to see that patency is present in both of your airways, and it is.
Oh.
We're gonna do your eyes now, okay? So I'm looking for any redness or drainage, signs of edema. I'm looking at the color. Your pupils are nice and dark. Your sclera is white. I'm gonna pull down to get a look at your conjunctiva, okay?
Okay.
It is pink and moist. Your eyebrows and eyelashes are present and evenly distributed. I'm gonna look at your pupil size. And I would say they're a 5. They're both 5, so they're equal. And now I'm going to check for dilation and constriction, okay?
Okay.
So if you can just go ahead and look at that picture frame over there. I'm gonna shine a light in your eye. All right, one more time on each side. Okay, so they are equal and round. Now I'm going to check for what's called your corneal light reflex. So one more time with the light, okay?
Okay.
And I'm looking to see that light is present in both eyes, and it is. So if you can go ahead and look at the tip of my pen and just follow it without moving your head.
Okay.
This is testing your 6 fields of gaze, your 6 cardinal fields of gaze. And testing for accommodation. Perfect. So your pupils are equal, round, and reflective to light and accommodation. So that's good. That's normal. Now I'm gonna look at your mouth, and I do have a tongue depressor for you. But first I'm gonna look at your lips, and they are pink and moist. They don't look like they're chapped or dry. Perfect. If you can go ahead and open for me. Getting a good look at your teeth, your tongue, your gums, your buccal mucosa, your hard and soft palates, and your pharynx. Everything looks good. Your teeth were clean, white to ivory color. Your gums, your buccal mucosa, your tongue, your pharynx, your hard and soft palates, all nice and pink and moist.
Okay.
One more time, will you open for me and say ah?
Ah.
All right. So I was just checking that the uvula rises at midline, and it does, and that is testing cranial nerves number 9 and 10.
Okay.
Can you go ahead and stick your tongue out for me? Move it side to side. All right, perfect. That's testing cranial nerve number 12. So all those nerves were intact by you doing that.
Okay.
Shows me that they're intact. I'm gonna move down to your neck, okay? First, I'm just going to look, making sure that the skin is uniform in color, it's intact, no lesions, no signs of edema. The trachea is midline. I'm looking to see that there's no enlargement or masses in the thyroid. If you can go ahead and swallow for me. All right, I'm now going to auscultate your carotid artery. I'm gonna do that with the bell because I'm listening for bruits.
Okay.
If you can go ahead and breathe in and out and then hold your breath. Perfect. We're gonna do the same thing on the other side, okay? All right, I didn't hear any bruits, so that's good. Now I'm going to palpate your carotid artery. Okay, I would rate that at a 2+ amplitude. Let's do the other side. And same thing for the other side, 2+. I'm going to palpate for a tracheal shift. And again, that thyroid, no enlargement or masses. Split your neck. No masses, no signs of edema. I'm going to feel for lymph nodes in the back of your neck, under your chin, and down your neck. And no enlarged lymph nodes, so that's good. I'm now going to assess your range of motion. So if you can go ahead and look, like move your neck side to side for me. Now look left to right, and up and down. All right, any pain or tenderness when you did that?
No.
Any pain when I touched your neck?
No.
All right, so you have a full range of motion with no pain, that's great. We're going to move on to your anterior and posterior thorax. So if you had a gown, I would go ahead and pull it down, but making sure to put it back up to maintain your privacy when I'm done looking.
Okay.
So I'm just gonna look, and I'm looking to see that your chest wall is symmetric. I'm looking at the skin, making sure it's intact, it's uniform in color, there's no lesions or major scarring. I'm gonna look from the side. Okay, just watching you breathe, I can tell that like there's no difficulty with your respirations, you're not using accessory muscles, and I would say that your APT ratio is a 1:2, so that just means that you're not barrel chested or there's no concave in your sternum.
Okay.
So now I'm going to auscultate your lungs, and then after that I'll auscultate your heart sounds. So I'm gonna go ahead and put my stethoscope under your shirt. Every time you feel it on you, go ahead and take a deep breath in and out through your mouth.
Okay.
And so I'm starting above your clavicle. Okay. I'm gonna go under your shirt now, okay?
Okay.
And then we're gonna get the lateral. One more time. Perfect, Amber. So now we're gonna listen to your heart, okay?
Okay.
So I'm gonna go under your shirt again, going at the right sternal border in the second intercostal space. That's what's called your aortic valve. Moving over to the left sternal border, second intercostal space, your pulmonic valve. I'm going to move down to the third intercostal space. It's called Erb's Point. I'm going to go up your shirt, okay?
Okay.
To your fourth intercostal space, and that is called the tricuspid valve. Again, still on the left sternal border. And then moving to the fifth intercostal space, mid-clavicular line is your mitral valve. This is also called your apical pulse, and we would listen for 1 minute here. But for the video, I'm just gonna listen for 10 seconds.
Okay.
All right, so I'm gonna flip my stethoscope over and go back up with the bell. I'm listening for bruits. Mitral, tricuspid, Erb's Point. I'm gonna go in through the top of your shirt to the pulmonic valve and the aortic. And I didn't hear any bruits. S1 and S2 were present, and no signs of S3 or S4. So S1 and 2 are normal heart sounds. They're the lub and dub that make like the heart sounds that you normally hear. And S3 and S4 are abnormal sounds. You don't want those.
Okay.
So now I'm going to palpate what's called the point of maximal impulse, and that's down here, okay? So this is a pulse. I would rate that at a +2 amplitude. I don't feel any thrills. I'm gonna go ahead and feel your chest, okay?
Okay.
Any pain when I touch you there?
No.
I don't feel any edema, no masses, no crepitus. You have no pain, so that's good. And I'm gonna go ahead and turn you around, and we're gonna do the same thing for the back, okay?
Okay.
Okay. Let's go ahead and again, I would put the gown down just to look for as long as I need to, and then I would cover you back up. So I'm looking at the skin. It is uniform in color. It's uniform in color. It is intact, and I don't see any lesions or major scarring. The chest wall again is symmetric. Scapula placement is normal. And I'm going to listen to your lung sounds from back here, okay?
Okay.
So I'm gonna go under your shirt again. All right, nice deep breaths, good job. We're gonna keep going. And then I'm gonna get the lateral side. One more time. Okay, so on both the anterior and posterior lungs, I did not hear any abnormal sounds such as rails or crackles, and those are things that we don't want to hear.
Okay.
I'm going to palpate. Let me know if you have any pain, okay?
No.
All right, so no pain. I don't feel any masses. I don't feel crepitus. I'm going to palpate for CVA tenderness, so let me know if you have any pain.
No.
And what about right here?
No.
Okay, perfect. So you can go ahead and turn back around, Amber. All right, so we are going to do your extremities, upper and lower extremities, and your abdomen. So that's your arms, your legs, and your belly.
Okay.
Okay. So I'm just looking at your arms first, looking at the skin. I'm going to lift up your sleeves. Uniform in color and intact. Muscle bulk is symmetric. I don't see any signs of edema. Can I go ahead and get a look at your hands? Nails are clean and well trimmed. Normal thickness and no signs of clubbing. So I'm just going to palpate your arms, okay?
Okay.
So I'm assessing for muscle bulk. It is symmetric and even throughout. Temperature is warm throughout, and the skin is nice and dry, like you're not sweating. I'm gonna look at the elbows, the bony provinces, and the wrists for signs of pressure ulcers. I'm also gonna palpate for edema. Do you have any pain when I'm doing this?
No.
No edema, and Amber says she has no pain. Go ahead and flip your hands for me, and I'm going to do a capillary refill, which means when I squeeze, the color comes back within 3 seconds, and it does, so that's good. We're gonna test your range of motion now, okay?
Okay.
So if you can go ahead and move your shoulder like this for me, and back. Same thing on the other side. Okay, perfect. Can you go ahead and flex your elbows for me like this? I'm gonna put some resistance on you. Don't let me pull them away from your body, okay?
Okay.
So go ahead and that way. All right. So that was testing your strength there, and that I would rate out of 5. Now we are going to assess the range of motion on your hands. So if you can go ahead and go like this for me. Perfect. So you have a good range of motion on your hands, and that is also a neurological test. So do that as fast as you can for me. Perfect. And I'm going to have you go ahead and squeeze my fingers as hard as you can. All right, that's assessing the muscle strength in your hands, and I would rate that out of 5. We're going to do one more neurological test, and if you can just go ahead and touch all your fingers like this. Perfect. So we did range of motion, we did strength testing, and we did 2 neurological exams, and everything looks normal there. If you can go ahead and lay on the couch for me, I'll go ahead and move the chair out of the way. Okay, so I'm going to assess your abdomen. So I'm going to provide patient privacy by going and putting this blanket over you. Okay. And is it okay if I lift up your shirt to get a look at your abdomen?
Yeah.
All right. So I'm going to look from the foot of the bed to get a good look at the contour. And I'm also going to look from the side of the bed. And it is symmetric. You have a flat contour, which is normal. And your umbilicus is midline. Your skin is uniform in color, no lesions or major scarring, and it is intact. If we were in a hospital, I would bring the bed up a little higher. That way I don't have to lean over you.
Okay.
So now I'm going to listen to your bowel sounds. All right. Listening in the right lower quadrant first. Right upper quadrant. Left upper quadrant. And the left lower quadrant. Okay, so I heard 5 to 35 bowel sounds in each quadrant, which is normal. That's normal activity for your bowels. There was no hypo or hyperactive activity. If I didn't hear any bowel activity, I would listen in each quadrant for 5 minutes.
Okay.
I'm going to palpate, so just go ahead and let me know if you have any pain or tenderness, okay?
Okay. No.
So I'm palpating each quadrant.
No. No. No.
Okay, so no pain or tenderness and no guarding. When was your last bowel movement?
Yesterday?
Okay, perfect. Now we're gonna move down to your lower extremities, okay?
Okay.
So again, I'll just provide privacy by giving you that blanket. And I'm going to look at the skin color. It is uniform in color. Muscle bulk is symmetric. No visual signs of edema. And let's see. Okay, could you go ahead and lay on your side for me? Okay, so this is where I would inspect the sacrum and I would also palpate it, but for the purposes of the video, we're not gonna palpate the sacrum. So you can go ahead and lay back down. And I'm now going to palpate your lower extremities, okay?
Okay.
So I'm feeling to make sure that muscle bulk is symmetric throughout. And I'm looking at those bony provinces, assessing for pressure ulcers. So I was looking at your knees and now your ankles. Assessing for temperature. It is warm and equal throughout. Skin is dry, not too moist. I'm going to palpate on the tibia for edema. And now I'm going to palpate your posterior tibialis pulse. I would rate those at a 2+, and I'm going to move down to your feet, and this is when I would put gloves on. And I'm looking at your toenails, and there are no signs of clubbing. They are clean and trimmed and normal thickness. I'm going to palpate your dorsalis pedis pulse. That would be at a 2+ as well. And I'm going to assess for capillary refill. And it comes back within 3 seconds, so that's good. While I'm down here, I'm going to do a neurological test on you. Okay. It's called Babinski's reflex. I'm just going to get the tip of my pen and go up your feet. And I'm looking for exactly what you did. I'm looking for your toes to curl. So that's one neurological test. We are going to do a range of motion on your feet. So if you could go ahead and put your toes toward you and then toward me. And now we're going to do that with some resistance, okay? So don't let me push your feet toward you. Perfect. Now point them toward you. All right. So I would rate that muscle strength out of 5. Now we're going to do a range of motion on your legs.
Okay.
Get rid of those. So let's go ahead and lift up. All right. Same thing for the other one. Perfect. So you have a good range of motion on your knees. They're able to flex and extend. Can you go ahead and lift one leg for me? Now don't let me push it down. All right. Now don't let me push it up. We're going to do the same thing on the other side. Now don't let me push it. Perfect. So I would rate your muscle strength out of 5 on your legs. And one more neurological exam, okay?
Okay.
So take the heel of that foot on your ankle and slide it up to your knee. All right, let's do the same thing with the other side. Perfect. And let's see, I'm gonna go ahead and take this off of you so you can sit up.
Okay.
And I'll help you up. All right, and that concludes your assessment. Do you have any questions?
No.
All right, thank you. Have a good day.
You too.